Hi, good evening, friends. I'm Dr. Rajiv Chukral. I'm a senior consultant in orthopedics and joint replacement surgeon here at Apollo Hospital, Noida. And today I'll be talking to you a little bit about some common sports injuries and how we can take steps to prevent them from happening. Now, understand that you're going to play sport, you are going to be victim to injury. Sometimes it's because you are not prepared, you're not warmed up enough, so you overexert certain muscle or ligament groups. Sometimes it's because of not your fault, but someone else banging into you, or an indirect sort of trauma. And the third time is usually because of a chronic or repetitive stress injury. So there are three types that you will normally see, whether it is the most common sport that we play in our country, cricket, or other sports which involve a lot of physical activity. There is going to be excessive strain, excessive overworking, and use of certain muscles, certain joints, and that can lead to injuries around those joints. For example, if you were to take the example that I give you of cricket in a country, so when you're a bowler, you can have a lot of injuries around your shoulder of the overarm bowling action, around your elbow. If you're a person who likes to turn the ball, you can also have injuries to the wrist, and of course to your knees and your ankles if you have a good long run up or a short run up with a lot of twist. And if you're a fielder, again, you can have back strains, you can have hamstring pulls, you can have throwing arm injuries, you can have elbow injuries. If you're a batsman, of course, you can get injuries because of your posture itself, because of the way you sort of slouch or sit forward to take your stance, or your running can cause injuries. And you can get injured by the balls hitting you while you're batting, either on the face or the rest of the body. So, similar to you can have injuries to different parts of the body depending upon which part is being exercised or overworked. Those sports that involve a lot of weight training, weightlifting, for example, powerlifting or weight training or weightlifting or boxing or whatever sports, like say the hammer throw or the javelin, all of these involve a lot of power which has been strained on your lower limb joints, that is your hips and your knees, so you can get injured there. And also on your shoulders and your back because you're adding all of this to your body weight. And those which involve a lot of, for example, overhead arm movements, for example, bowling or tennis or badminton, will have a likelihood of having more injuries to both the shoulder, the arm, the elbow, and sometimes to the wrist. So the gamut of injuries is extensive. If one was to look at the upper limb, you can actually involve injuries to the shoulder, to the arm itself, to the elbow and the muscles around the elbow, the ligaments around the elbow, to the forearm muscles, to the wrist, to the fingers while you're playing any sport. You can also get injuries to your neck if you're having certain whiplashes during your movements or sudden turning or twists. Football, for example, causes a lot of injury to both the neck and the lower back because of sudden acceleration and deceleration that you have to do. And you can also get very commonly injuries, which you all have heard about, to the lower limb, which starts from the hip to the thigh, down to your knee, your calves, and your ankles and toes. So this is the entire gamut of the injuries that you can get. But one must understand that before you actually venture down to a sport, obviously you have gym instructors, you have sport trainers for you who will tell you that you need to warm up. So warming up before a particular game or a particular sporting activity is essential so that you increase the blood supply, you improve the flexibility of your muscle groups, you improve the ability of your joints to be exposed to excessive strain, excessive forces, and at the same time you also improve your cardiac output by say a little warm-up jog or a little exercise of stretches, because this will make sure that suddenly too much force is not put on your particular muscle group or your your joint. So the warm up is very good, very important. In addition, we also for elite sportsmen talk about something called prehab or prehabilitation, which is basically excessively training and exercising strengthening or improving the flexibility of those muscle groups, those joint areas which are going to be strained during that particular sport. For example, if you're going to be doing weight training, you must have a very good strong core. So your lower abdomen, your lower back are supposed to be made stronger, and that is done by what is called prehabilitation by the physiotherapists or by the gym instructors or by the sports trainers, who will focus on that particular area to improve the muscle strength and the bulk of that area, so you can proceed with that particular sport. People who do a lot of running, for example, athletics, or long distance running, or even for that matter, football or hockey, have to have good sort of stamina. So for that, you need to, you have to train your muscles and you have to build your cardiac output, which involves a lot of training exercises which focus on building not only your endurance, your stamina, but also your lower limb muscle mass and your lower limb muscle strength. So that is rehabilitation. So one, of course, was a good warm up before any exercise. You have to have rehabilitation if you're into active sports, especially if you're an elite athlete. And then once you've done with your sport, you must understand that you go up to your limit and you can just go beyond your limit. But if you're not regularly doing a particular movement or a particular physical activity during your training sessions, and if you try to exceed that, there is a pretty high likelihood of having that injury. So make sure you stay within your limits, and you have to strain beyond, and you must not strain too much beyond your limit of what you have done in practice sessions. And after the sport's done, after your event is over, then it is important to also cool down. All of these ensure that with your cool down, of course, again, you have a little bit of, say, a light jog or a little warm sort of stretches and some ice packs applied to the area which have been overworked, so that your body's metabolism returns to normal. There's enough time given for the toxic metabolites and the waste products of your physical activity to be washed away and to be thrown out in the urine. And of course, ensure that you have adequate hydration and nutrition immediately post your sporting activity. Now, this is what we tell most patients or most sort of sports persons to actually follow: a good warm up session, uh, sporting event session where you actually play within the limit that you have practiced or just beyond, and not do something which is suddenly out of the ordinary. And of course, once you finish with the sport, you cool down. Now, try to understand that kinds of injuries that you may get in sports depend upon whether you injure the joint tissues or you injure the muscle masses around that. So you can get a different kind of injury. You can get, for example, muscle partial tears or muscle complete ruptures, which can happen either at the fleshy part of the muscle or the musculo-tendinous junction, which similar as a muscle, but occurs through the tighter and the stronger part of the muscle, and they behave a little bit similarly. So you have minor strains and sprains, and you can have muscle tears. And if they are involving the joint region, of course, then they involve the ligaments around the joint, because there are ligaments which help in maintaining the normal ability of the joint to move, avoiding or preventing excessive or abnormal mobility. So if you overstrain one of them, you can actually tear the ligaments. You can actually partially tear them like a strain, or you can completely tear them, which have to be treated separately. Or sometimes you can damage the cartilage sort of fragments inside your joint, or the articular surfaces, that means the bone ends inside the joint, with your sporting activities. And very rarely, not so rarely now, but you can also cause fractures around the joints because of the excessive rotation or twisting, for example, during football or even cricket sometimes. So difference between injuries to the muscles and the ligaments have to be understood, because they are different in terms of how they are rehabilitated. They are different in terms of how they are picked up, treated immediately and in the long term. Now we're talking all about acute injuries, right? There's a separate set of injuries which occur because of repetitive stress. So a person, for example, who has a long distance running a sort of activity, for example, a marathon runner, or a person who does a steeplechase event or a 5 kilometer, 10 kilometer run, can easily get stress fractures in either the shin bones or in the feet, the small bones of the feet, and that, of course, has to be tackled differently. So these are chronic injuries; they are repetitive stress injuries which come under a different parameter. So how does one actually treat this? I will tell you first, and then we'll talk about how to prevent it using specific techniques. But The treatment in the acute condition when you have an injury, a sports injury, is actually based on the principle of RIC or RICE, which is resting that injured part. Because if you have an injury, you don't want to actually increase that injury by trying to move that area. So you rest it. Then, of course, icing is a very good idea because icing reduces the swelling, it reduces the pain, it reduces the spread of the inflammation to surrounding areas. So, icing of that area is what you will see most physiotherapists who are trained in sport to come out to the field and do. Compression sometimes is required to prevent excessive swelling or to reduce the amount of pain, which is either with a crepe bandage or with caps or braces. And last but not the least, you have elevation. So, is the RICE or the rest ice compression elevation principle which one must follow following any acute injury as primary treatment. Of course, after that, then you have to get it investigated and check whether it's actually something bony or something muscular or something ligamentous, and then treat it accordingly, which I'm not going to talk about today because that's not the scope of this Facebook session live. Now, we understand that all these injuries can occur, and they usually occur in people who either don't warm up properly or who have overstrained while doing their sporting activity or who have not cooled down and gone back to another session of sport without the adequate recovery phase that we say happening between the two events. So, the first and foremost thing that one must do and one must understand is very important in prevention is having strengthening of your core muscles. Now, the core muscles are what keep your balance. That means your lower abdomen and the lower back muscles actually maintain the balance. They keep the body in a perfectly aligned manner when you're doing normal activities as well as when you're doing sports. And it is much more important during sports because what happens is if you're pivoting around and trying to twist or you're trying to suddenly accelerate or decelerate and the core is not balanced, then what happens is you end up putting more load on either the front or the back of your body. So now that we have understood what different kinds of injuries can happen and which all parts of the body, which all areas, and also which sort of portion of the musculoskeletal system can be injured, one must understand how to prevent these injuries. Now, understand that prevention depends upon two or three major core principles. The first one, of course, is that of strengthening of the core. Now, the strengthening of the core is important because the core of the body is what is responsible for your balance and for preventing overloading of any half of the body. So, most gym instructors, most sports training surgeons, or most trainers of different sports will talk about strengthening your core by strengthening the lower abdomen and the back so that your balance is maintained during your sporting activity. So it's very essential that you follow this principle as your prime method to prevent injury. The second is, of course, to understand which part of your body or which area of the body is going to be overloaded and to build that up by what is called prehabilitation. So you actually use strengthening exercises, stabilization exercises, and flexibility exercises to strengthen and also improve the flexibility of that particular area of the body which is going to be overworked during your sporting activity. For example, those who are involved in predominant throwing, for example, the bowlers in cricket or javelin throwers, or for that matter, shot putters, have to focus on building the area around the shoulder, the scapular muscles, the arm and the biceps and the triceps muscles, so as to make that area strong enough to withstand excessive loading during the sporting activities. In the same way, if you're a person who does a lot of weight training, you have to build your lower back, you have to build your abdomen and your your muscles around the knees and your hips, because a lot of load then falls on that area. So these include the concepts of core training, which is the principle of sports injury prevention. The second is that of rehabilitation, where you actually strengthen and increase flexibility of that muscle group and that joint area, which is going to be overworked during your physical activity or sporting activity. The third is something called understanding the limitations of your body as well as your sport. Now, if you have a good idea and a fair idea of how much you can achieve during your practice sessions, you understand without, of course, injuring yourself because you're doing it under controlled conditions, you must try to replicate those conditions, you must try to replicate the amount of the ability of your body to stretch or strain up to or just beyond that level, because otherwise you will definitely end up with an injury unless you've trained for it in the past, unless you have followed the right technique for that. This is difficult to happen. So the good training sessions which actually help decide or give you an idea of the capability or the ability that you can strain your body to is something each individual athlete must understand along with the coach that is training that athlete. So the concepts of core training and then rehabilitation along with understanding limitations are the core principles of trying to prevent injuries. Of course, one should also understand that you can get injured in spite of all of that, so you need protective gear. But protective gear by themselves are not enough to prevent you from having any and every kind of injury, because they can only prevent direct, blunt, or direct object injury to you. So, whatever pads, whatever guards, whatever helmets that you need to wear during a sporting activity actually prevent direct injury. So, they are sort of important for you to take on and understand. One must not underscore the importance of the nutrition and hydration, because understand that for any physical activity, there is a certain minimum amount of nutrition that the body needs. Of course, there is something called a recommended daily allowance for not only carbs and proteins and fats and minerals, but also vitamins. And a sports person usually requires a higher amount of sort of daily nutrition in terms of all of these macro and micronutrients. One must understand and take proper nutritional supplementation where required under the guidance of a good sports nutritionist. And last but not the least, it's very important to also understand that the game is a mental thing. So if you're psychologically up or psychologically down, you can actually have less or more injuries depending upon what you do. If it's a good day, you know that you can manage and you think you attribute it to luck, but actually it's because you were more aware of your surroundings and you were more into the sporting activity. So keep that in mind. Have a positive mind frame before going in for a sport. At the same time, understand the basic principles of prevention of injuries. Even in spite of that, make sure you are protected with the correct protective gear during your sport and enjoy your sport, because after all, it should not be a competition alone. It should be also something you enjoy, and that's why you are doing it. If there are any questions on this or any other questions that you may sort of have regarding sports injuries, I'll be very happy to answer them. I hope you understood a little bit at least about the basics, understood that there are different areas that can be injured, different types of tissues that can be injured during sports, but there are very simple ways to prevent injury or damage to them. Thank you for patient listening and have a great day. हो गया इंटरनेट की तो एमबी हो गई यहाँ पर MB वहाँ है